How does endoscopy help diagnose IBD for sensitive stomachs? Imagine being able to see inside your digestive system without surgery. That's what endoscopy offers. If you have a sensitive stomach or conditions like irritable bowel syndrome or colitis, understanding how this test works can make you feel more comfortable. Endoscopy uses a thin, flexible tube called an endoscope, which has a tiny camera and light attached. The doctor gently guides this tube into your digestive tract to look for signs of inflammation or other issues. The most common type for diagnosing inflammatory bowel disease is called a colonoscopy. During a colonoscopy, the tube is inserted through the rectum and carefully moved through the entire colon and sometimes into the small intestine. This allows the doctor to see the lining of your intestines directly. If they notice redness, swelling, ulcers, or other abnormalities, they can take small tissue samples called biopsies. These samples are sent to a lab to check for inflammation or disease markers, helping confirm if you have inflammatory bowel disease. Another option is a flexible sigmoidoscopy, which only examines the lower part of your colon and rectum. This procedure is less invasive and can be a good choice if your symptoms suggest issues mainly in that area. It's quicker and usually involves less preparation, making it easier for sensitive stomachs. Sometimes an upper endoscopy is performed. This looks at your esophagus, stomach, and the beginning of your small intestine. While it's less common for diagnosing inflammatory bowel disease, it can be helpful if your symptoms include nausea, vomiting, or upper stomach pain. For those with sensitive stomachs, endoscopy might seem intimidating, but it's generally very safe. You'll need to fast before the procedure and follow specific bowel prep instructions to clear your intestines. This helps the doctor get a clear view. If a full colonoscopy feels too much, your doctor might suggest a flexible sigmoidoscopy instead. The main goal of endoscopy in diagnosing inflammatory bowel disease is to see the actual condition of your intestinal lining. Unlike other tests that only look at symptoms or blood work, endoscopy provides a direct look. This helps doctors distinguish IBD from other conditions like irritable bowel syndrome, which doesn't cause visible inflammation. Knowing exactly what's going on inside helps determine the best treatment plan. In short, endoscopy is a key tool for diagnosing inflammatory bowel disease. It allows doctors to see inside your digestive system, take tissue samples, and make accurate diagnoses. For those with sensitive stomachs, understanding the process can help ease worries and ensure you get the right care to keep your digestive health on track.